The scar on Vance Jirava's right knee only tells part of the tale of his journey to Sanford Health. The farmer from Ogema, Minnesota, had his knee replaced this January, but the other scars on his leg made this surgery a bit different.
1993, I broke my femur just above the knee and on a snowmobile. Spent a couple weeks in the hospital.
30 years later, the wear and tear of farm life had taken their toll.
Oh, some days were unbearable. When I got a couple of them cortisone shots, and then I thought I could maybe go play football again or something, like there's no pain, but yeah, they wore off real quick. I got 2 of those and made it through harvest, and I wasn't going to go through another harvest like that.
This winter, Jirava opted for a total knee replacement with Dr. Joseph Brunges, an orthopedic surgeon at Sanford Health Fargo, about an hour away from his farm.
With the knee replacement, we remove all the regions of the cartilage and we replaced it with metal and plastic. The metal and plastic then acts as the cartilage in the bearing surface to create a nice smooth gliding surface. In his case, with it being a post-traumatic scenario, he had a lot of extra bone spurs that were likely affecting a lot of his range of motion.
Before the surgery, Jirava walked with a limp. He couldn't fully straighten his leg, and he could only bend it back to 105 degrees. Today, he has full range of motion from straight to 124 degrees.
Oh, definitely night and day. Just in and out of machinery, up and down, and I feel like 30 years younger.
Best of all, Jirava said he was recovered in time for planting season, which is something Dr. Brunges knows is important to many of his rural health patients.
We do a lot of the work to give a patient a good knee, but it's really important for the patient themselves to spend the time to strengthen and get back to where they need to go. In this case, his profession is working out in the fields. When we do surgery in January with the expectation of planting in March, we know that we're kind of pushing the time frame a little bit. Vance did a great job doing all the things that I asked him. He did the exercise program throughout the day. He also did the working with the biking, and he was able to get back to pretty intensive labor within 3 months of surgery.
This year's harvest should be a bit more comfortable for Jirava, at least physically. The scar on his knee now acts mostly as a reminder of past pain, while his new knee points to greener pastures ahead. In Fargo, Jason Anschutz, Sanford Health News.